My name is Britney Grayson, and I'm a consultant pediatric surgeon at BethanyKids Kijabe Hospital in Kijabe, Kenya. It's a true privilege to work here, not just to take care of the Kenyan children with surgical disease, but also to help train the next generation of Christian pediatric surgeons for the continent. Our current trainees are from Kenya, Ethiopia, the Gambia, and Sierra Leone, and they will join our 12 graduates on the wall behind me who currently work in 10 different countries, meeting the surgical needs of children on the continent. The mortality rates for children with congenital gastrointestinal anomalies in Africa are as high as 100 times that of North America and Europe. And this is in large part due to a scarcity of specialty trained pediatric surgeons. There is on average one pediatric surgeon per 4 million people in Africa, compared to 16 pediatric surgeons per 4 million in the US, for instance. And what this means is that the parents of these children so often have no hope. In one of my first few weeks on call, I met a 5-day-old infant who was brought in by his mom for abdominal swelling and trouble breathing. And on our exam, it was readily apparent that he was born without an anus. There was no way for the stool to pass out. And so as mama fed him, his abdomen grew bigger and bigger to the point that he couldn't breathe. And the interesting thing about this patient is that he was born in a hospital and he was examined by a clinician. And now mama was aware that he did not have an anus, but she didn't say anything because they're the doctors, right? And she thought if they didn't speak about it, it was because there was no cure. And so she took her child home, but not content to just watch him die. She began speaking with friends and was encouraged to come to Kijabe for a second opinion. It was incredible to sit with that mama as she cried tears of joy upon hearing of the healing, Jesus' healing, that was going to be possible for her son. But you can imagine that impacting a patient like that is a multidisciplinary effort, and BethanyKids is committed to educating pediatricians and advanced practice providers, called clinical officers here, about pediatric surgical conditions and critical care. Additionally, our programs are multiplying. 2 of our graduates in Rwanda have started their own training program. Others of our graduates will go back and be the only surgeon in their country. And those were the huge shoes filled, for instance, by Dr. Ayalebi when he returned to Sierra Leone in 2013. You can imagine that this costs money though, right? I know what you're all thinking. So I'll start by telling you that it costs over $1 million to train a surgeon in the US. In Africa, it costs about $100,000. And that surgeon will go on to see and treat nearly 100,000 patients in their career. You can imagine that there are also some differences in the training. I'm not only training pediatric general and thoracic surgeons, but also surgeons who will be their own urologist, gastroenterologist, radiologist, even maybe practice some ENT and plastics. And our trainees, they're just the most humble and kind people that you'll ever meet. I find when I'm teaching, when I take the time to teach in a consult in the middle of the night, for instance, that teaching moment is met with such gratitude that it's almost unbelievable. And when you think about where our trainees come from, that starts to make a little more sense. They come from countries or regions where there may not be qualified general surgeons, much less specialty trained pediatric surgeons. They come from homes and backgrounds where they couldn't dream of affording paying their way through training in one of the big cities on the continent. And so investing in these surgeons returns such a huge yield. And BethanyKids is committed to the success of our graduates. BethanyKids walks alongside our graduates to make sure that they have what they need to continue providing healing physically and spiritually in the name of Christ to their patients. I invite you to join us in being part of this work, and I look forward to partnering with many of you.